Hello and welcome everyone to this session on HIV and Anesthesia Part 1. My name is Dr. Jhanvi and today I'm going to be taking a topic which is not very common. Okay, so this is not a topic that will come in your practical exams, nor is this a topic that is often asked in theory, but there are some very specific things that you have to write about if they ask you in any of your theory papers about HIV and what are its implications in anesthesia. So I have divided this lecture into two parts. The first part will have a lot of questions on HIV. And here we are going to discuss the prevalence, how does the HIV virus get integrated into the CD4 cells, what is its pathophysiology, what are the routes of transmission. So that is going to be today's lecture. So you all might feel that you all are actually in a medicine class, but actually the thing is that when you get these kind of topics in the exam, the examiner knows that there are only 2-3 specific things regarding HIV and anesthesia, like you have to use universal precautions and you have to make sure that you're wearing PPE kits and you're handling blood with care and all of those things. So they will tend to ask you more of the medicine related questions. Now, the questions that I have put for this lecture, as I'm telling you, are also going to be very useful for you all when you all appear for your post DNB super specialty examinations. So in the super specialty critical care part, they tend to ask a lot of medicine related questions about infectious diseases. So for those of you who are planning to give that super specialty exam also, what we discussed today will be useful. Okay, so forget that today is going to be an anesthesia class. It's going to be more of a medicine class. I am also asking all of you all to participate in the chat, and whatever you all remember from final MBBS infectious diseases or NEET PG preparation for infectious diseases, you all try to answer. Okay. So with that, let's discuss about HIV. So in HIV, when we talk about AIDS, now the most basic thing, we have Anandita, Ranjit, HH, and Vaishnavi, and a lot of people here. So can you all tell me what is the full form of AIDS? Very simple question. The most basic question that can be asked. What is the full form of AIDS? See, HIV is the virus, human immunodeficiency virus, and AIDS is the disease. So you will be asked what is the definition of AIDS. But before talking about the definition of AIDS, yes, very good, Vaishnavi. So full form of AIDS is acquired immunodeficiency syndrome. Okay, what happens is because we have not studied this medicine part for a long time, we tend to forget all these basic things. You may even forget the full form of AIDS. All right. Okay, so this is the full form of AIDS. Now, can you tell me when do I actually define that a person is having AIDS? Person is infected with HIV, fine, but I cannot say that the person has AIDS. There has to be some defining criteria. Okay, so I will tell you what is the definition of AIDS. AIDS is given when HIV serology in the patient is positive, as in you have done some tests in the patient like an enzyme immunoassay or Western blot, or you have done RNA PCR and you have found that the patient has antigen of the HIV virus or the patient has developed antibodies against the HIV virus. Okay, so that is called as HIV serology. So HIV serology has to be positive. Plus, along with that, your CD4 count should be less than 200 cells per cubic millimeter of blood. Okay, so this is the exact definition of AIDS. Now, when we say that the CD4 count should be less than 200, can anyone tell me what is the normal CD4 count? Can anyone tell me what is the normal CD4 count? Any idea? Yes, so the normal CD4 count is anywhere between 800 to 1200 cells per cubic mm. And in as HIV progresses, see, it's not like you'll get infected today and tomorrow your CD4 count will become less than 200 or after a month. It takes almost 8, 10, 12 years for the CD4 count to fall. And that is how we will see ahead how we define AIDS as per the stages. Okay. And the stages of AIDS are defined as per the fall in the CD4 count. So the CD4 count decreases over a period of time till you get a CD4 count of less than 200. And when your CD4 count is so low, your patient becomes highly immunodeficient and he becomes very vulnerable to infections like pneumocystis jirovecii, cryptosporidium, cyclospora. All these are not the very common infections, but they are very like specific infections which generally don't affect people with a good immune system. But because our immune system has collapsed and we have got AIDS, these are the infections that you will see. Okay. And you know what happens? Like, I don't know if you all watch House, but in an episode of House, I had seen that the minute they had a patient whose HIV test turned positive, immediately they could say that, okay, this patient is having seizures. That means he is having some kind of CNS infection. And the CNS infection, which is opportunistic infection in AIDS, is toxoplasmosis. So it becomes so easy to actually diagnose different infections in these people because there are these specific AIDS defining illnesses that you will find in them, which we will see ahead. Okay. Now, not very important, but the genus that HIV virus belongs to is Lentivirus, and the type of virus or the family is Retrovirus, or it is Retroviridae. Retroviridae. Okay. All right. Now, let's have a look at what is the prevalence of AIDS. So they may ask you this, especially the old-timer examiners like to know whether you know idhar udhar, you know, how you read newspapers. So old-timer examiners assume that you must be reading newspapers and you must be knowing that the prevalence of AIDS is increasing in which states and all that. So they will ask you these questions. So initially, the prevalence of AIDS used to be very high in Manipur, okay, and the northeastern states. But as of now, the prevalence of AIDS in India is the highest in Mizoram. All right. But if you see the 55% of the cases, out of all 100% cases in India, 55% of the cases of AIDS are present in 4 states. Which are these 4 states? Highest is Maharashtra. Then we have Tamil Nadu. Then we have Karnataka. And then we have Andhra Pradesh. Okay. Now, there is also a reason behind this. What is the reason behind this? So generally, if you see that these states are the ones that achieved urbanization very quickly. Okay. And as a result of urbanization, they created a lot of jobs. There were lots of jobs. So people from villages tend to come to these cities, like Mumbai or Chennai. So the big cities are populated with all of these people who are coming from villages. Now, as the number of people increased, accordingly, the type of services provided in those urbanized areas also increased, like prostitution. Okay, you're staying away from your family and prostitution flourishes in these places. So as a result of this, the sexually transmitted infections also increase. So if you look at the reason for increase in or highest number of cases in these 4 states, it is because of the rapid urbanization and migration of the population. All right. Okay. Now, what is the major age group? Obviously, when we talk about HIV, it is most commonly transmitted sexually. So, which is the sexually active population between the 15 to 49 years of age? So, that is the age group where you see AIDS the most. And if you divide it between males and females, what is the incidence of AIDS? Then we see that in 61% of the males, you will, out of 100%, 61% of the patients of HIV are males and 39% are females. And most of these females are the ones who have actually contracted HIV infection from their partner unknowingly. All right. Okay. Now, we have spoken about the epidemiology of AIDS. But in your exam, they may ask you, okay, doctor, do you know that there are different subtypes of HIV viruses? You have HIV-1, you have HIV-2. So which one is common in India and which one is common all over the world? Okay, so this is a very, very important question that they may ask you in the exam because they want you to know that with the antibodies that we test against the HIV viruses are tested against which virus exactly. Okay. So HIV-1 is the common virus in India. And if you look at African countries, HIV-2 is the common virus over there. Okay. So for us Indians, HIV-1 is the most important. But HIV-1 is not a very good virus. Why is it not a very good virus? Because it takes only 10 years since you got infected to develop HIV into AIDS. Okay. So this you may feel that 10 years is a lot of time. Okay. But if you look at the different types of HIV viruses and you compare, you see that for infection to AIDS, it takes 10 years in HIV-1, but for infection to AIDS in HIV-2, it takes 15 years. So technically, I would say that HIV-1 is a more aggressive virus. All right. Okay. Now, if someone asks you, this is just for MCQ purposes, if it comes in your super specialty examination, that which is the exact virus that is most commonly found in India, then it is HIV-1 group M subtype C. All right. So this is about all about the epidemiology of AIDS, and if they tend to ask any of these questions in your super